Okay, let's take another look at these numbers. So where we're sitting, we're in the 5th of May. So if this is the recent data from yesterday, 4th of May, 27 new cases yesterday. So the spread rate, we've gone all over the place and sort of trickled down into a very, very low. These social measures have worked to some extent with the numbers in these double digits, low double digits here. Active cases, that's just taking the previous people that have been infected at the daily rate. So that presumes that people, that's about 20 odd days, these people have recovered. Some of them unfortunately may have died, but the active cases, that's plotting quite nice. It's actually underestimating, if anything. So if you have a look at this data here, current active cases is 865, and I'm saying 716, so close enough there. You can see here the interesting part is that the drop of the active cases currently infected is this red line, and we're going into, instead of hitting to zero, we're going into what's a long tail. So that will drift off and for a long and never quite hit zero, or take a long time to get to zero. So if you wanted to plot that forward, you can see while you're still getting cases, you're always going to have the sum of some of these people. Yesterday, 27 new cases that we know about. That's obviously the caveat there is that's the tested and confirmed cases. There could be 10 to 50 times this number in the population. So the interesting thing is, we're talking a very low spread rate. Now, we know that the spread rate, this is the thing that is interesting, is we know that the spread rate before was around 20 to 30% per day, right? That's without the social measures, is about 20% a day. So just with a simple calculator, if you took the current active cases, let's just take this number, say it's 700, and you say what would it be in 10 days time, you go from 700 to 4,000 cases in 10 days at 20%. But if things sort of relaxed, our social measures relaxed, and we went to something sort of halfway in between, let's say not completely relaxed like it was before. I think the original, if you go back up here, let's just get these numbers. So 13, 24, 26, this is the spread rate that we're getting prior lockdown, these sorts of numbers. That average, let's have a look, 19%. Okay, we'll leave it at 20. If we go somewhere halfway in between, people are wearing face masks, and maybe restaurants are still closed, there's distance, there's no large gatherings. Let's say it's 10%. We've got, let's say, what happens 50 days later, which will be 31st of May. So it would go from our so if that happened from tomorrow, if everything went back to normal tomorrow, and we went to some sort of in-between measure where there's a lot of relaxation, and we went from our current spread rate of 0.4, 0.2 to 10%, so it's a big relaxation of the social measures. We've got, let's just say, 700 active cases. 50 days later, which is the 31st of May, you'd have 82,000 cases, with, at the current death rate at the moment, it's 1.4. So what do we got here? Based on the data, we've had 97 deaths out of 6,849 cases, which is 1.42%. So we've got a better grasp on the death rate. So 1.42% of this many cases is 1,166 dead people, if we presuming these things. Now, if you want to go more than 50 days, let's say what happens 100 days, you're getting these numbers. Now, that will be July 2020. I don't know if someone can say my maths is somehow wrong, but if 10% is true, well, it may alter, but we're presuming it's 10% a day, which we're getting. you get some really, really big numbers. And that's holding that percentage down. So that's the same percentage. So something has to change here. So the death rate must have to go down. I mean, obviously a vaccine would do that. There's still, must remember that there's only 7,000 people in Australia currently that have been affected, which means that still 25 million people are susceptible to the virus. Spread rate is 10% if you relax it. You're getting this mortality rate equals this number. Now, I don't know how this is incorrect, but this is the result if you relax social measures. You can say, okay, there's somewhat relaxation, maybe it goes to 5% a day, and you'd get these sorts of numbers. You'd get so maybe, but 5% is back where we were having 5% was around start of April, but that was still in pretty strong lockdown. But the growth rate of this thing is very rampant, and this is what my fear is when things return back to normal. And I definitely understand that said of the rationale in bringing things back to normal from economic reasons. So I'm not saying this is independently looking at just a mathematical approach.